class. My name is Ashley Cox, and today I'm going to be talking about the behavior modification theory. In 1938, B.F. Skinner proposed that human behavior could be shaped by positively reinforcing desired behavior and punishing undesirable behavior. Now, if you know anything about B.F. Skinner, or you've taken psychology, or you know anything about behaviorism, you'll know that B.F. Skinner, they call him the father of behaviorism. He's really shaped what we know to be behaviorism. A lot of the terms are his terms. Everything that he has done has kind of worked and revolved around behaviorism, and so he's a driving force in the theories of behaviorism that we know today. So I came up with a quick breakdown of just a few of the unique terms, just so you can kind of understand them. Behaviorism is a learner's behavior is shaped through positive and negative reinforcers. That's what we're going to be talking kind of about today. Tabula rasa will be something you may see, especially if you're in psychology, and it just means clean slate, just starting over fresh. Conditioning is an innate response to a potential stimulus. A reinforcer, that's a consequence that causes a behavior to increase. And then a punisher is a consequence that causes a behavior to decrease. Those two can be a little bit confusing. They seem like they're similar, even though they're not. So in a little while, I'll kind of go over that again. And if those confuse you, you can kind of write them down as I talk, and it gets a little bit better, I promise. And then the last one is it's called challenging behavior. It's maladaptive, it's destructive. It could be like a tantrum. It could be any sort of behavior that you do not want to keep going. It's not a good behavior. So, all right, and some of the unique attributes here. We have shaping behavior. Basically, this theory is good for promoting good choices while disciplining bad choices. And when you promote the good and discipline the bad, it shapes a behavior, and it helps overall. It also modifies the client's attitude. If you're dealing with somebody who just had a serious spinal cord injury and they're really upset that they are paralyzed and they will never walk again, if you work with them while they're upset, you will not get anywhere with that client. This theory is great at pairing a terrible situation with something good. So you come up with good outcomes, you come up with education and things about the situation that are not so bad, and it'll help a client understand that the situation will be okay, and when their attitude is changed, they'll be much more willing to open up, they'll be much more willing to work, and their outcomes will be much better. And also, another unique attribute about this theory is they call it behavioral manipulation, and this one's kind of funny, but it's basically what it is. I mean, it's good because you're trying to get their behavior, you're trying to promote good behavior, and you want them to make good choices. And so this is great because it helps to keep the positives positive, and it focuses on the good behavior and tries to get rid of the bad behavior. 3 desired outcomes for success. Like many of these other models and theories, we just want the client to be happy. That's so important. That is a huge desired outcome for success. Along with this model, though, there are 2 others, progress and a higher frequency of desirable activity. So that's like promoting good behavior through behavioral modification. And also strengthening positive behaviors through the use of positive behavioral support. So we want a higher frequency of good behavior, but we want to strengthen the sense of doing good behavior so that they feel good about doing good behavior and they want to leave that bad behavior behind. And application to TR A TR can help a client by changing their mindset about their impairment or situation by pairing current problem to a healthy stimuli. A TR can help change the client's attitude toward their impairment or their situation and can help them to manage their behavior to promote health and wellness. This is huge because, like I was saying earlier, it is nearly impossible to work with somebody unless they're willing to be honest and open with you and willing to work. And a lot of times when we have a client that comes to us that needs our services, they're at like their lowest point. They've just been diagnosed with cancer, or they've been in an accident, or they have a terrible situation where they just feel like they're out of control with their life. And when they come to us, they will be having a really difficult time. And it's our job to help them pair that difficult time with positives. I mean, we see this in the gospel and in our own lives all the time. You know, like I talk to people and, well, their parents are divorced and that's hard, but they've learned so much from it, you know? And so if you focus on what you've learned, what you've gained, how you've grown from the experience, and you promote health and wellness and happiness, and you change the way the client sees themselves and their situation, it just opens the door, a whole new door to the possibilities, and the outcomes are so positive when you do this. Things improve greatly when you do this, and this theory is so important because it shoots the success skyward when we are able to apply this theory and a client's attitude becomes more positive. Next we have population. This theory, really, it benefits everybody. It's flexible enough to work with children and the elderly. It all just kind of depends on the TR's strategy and understanding the different parts of the behavior modification theory. There are many, many different moving parts to this theory, and so it is important for the TR to be able to understand how they work and to understand if they will in fact benefit the client. Plus, it's important for them to be able to apply them correctly, because if they're not applied correctly, it's not going to do anything to help the client. Okay, so potential assessment tools. Assessing a client is one of the most important parts of what we do. I don't really even need to say that. I probably should have taken that part out because really we all know how important assessment is. But a tool that can be helpful while assessing a client who has just kind of experienced the behavioral modification theory or who has worked with a TR who's implemented the behavioral modification theory is communication. Communication will allow you to kind of just gauge their responsiveness, their conversational skills, and their body language. Those are three huge things. You'll be able to compare how they did before to how they're doing now just by looking at them, watching their body language, seeing if they're comfortable, seeing if they're willing to talk, if they're responsive. It's communication is wonderful at assessing a client and just trying to figure out what's going on in their mind. When you can understand what they're thinking, then you can understand how to better help them, and when they communicate with you about therapy, you're better able to understand how to help them, and you're able to see if you've reached your outcomes, reached your goals, and other things like that. So here I have posted a little picture, and I'm sorry it's so small. I don't know why it's like that, but I'm just going to help you understand really quickly the difference between a reinforcement and a punisher. And when I like to do this, I like to kind of split it up a little bit. So it's positive reinforcer and positive punishment, and negative punishment and negative reinforcement. So when I see those words, positive reinforcement, I always make sure that I add a little plus sign when it's positive and a minus sign when it's negative to help me remember exactly what they do. So a positive reinforcement, that's adding reinforcement, which is good stuff. So when you add good stuff, that's like giving a treat, walking, or like in this example, walking without yanking the dog on the leash because the dog is doing what it's told. That's adding things that are good. But when you have a positive punishment, you're adding positive add bad stuff punishment. So when you add bad stuff, that's leash correction, tugging on the leash when the dog isn't doing what you want. That's adding more chores to a child's list who's not paying attention to you, and things like that. And then on the flip side, we've got negative punishment, which a negative punishment, that's taking away, that's ending the good stuff. So that's no more treats. When you're walking a dog, that's stopping and waiting for the dog to stand still. And then a negative punishment, or a negative reinforcement, I'm sorry, that's ending the bad stuff. So when a dog is doing what it is told, you stop the leash correction. That's giving the dog a little bit of freedom, I guess, and that's ending the bad stuff. This was something I found from the book as just a little bit of a side note. I found this really, really interesting, and this is really important to remember. These are the 4 main reasons for a challenging behavior. Now remember, challenging behavior, that's maladaptive. That's not what we want. We want a different behavior because challenging is difficult. And I like to remember it in the acronym EATS, E-A-T-S, and it's perfect because Thanksgiving is right around the corner. So E stands for escape. So sometimes a challenging behavior will come about because a person is trying to avoid an undesirable task by escaping. A stands for attention. Again, this one's pretty self-explanatory. If you're doing something with a client and they want your attention and they have an upset, challenging behavior and it's because they want your attention, that's another reason. And the T stands for tangible. So that's when somebody wants a toy or wants something that they can hold in their hands. And then S is sensory overload. And these are so important because when you have a client with sensory overload, there's too many people, there's too much light, there's too much noise, sound, whatever, and you would not help a client that's having a challenging behavior over something tangible the same way that you would help a client who's having a challenging behavior over something where it's a sensory overload. So when you figure out why there's a challenging behavior occurring, you're best able to figure out how to correct that. That way you can apply this theory in a way that will benefit the client when you understand why the challenging behavior is coming about. Thank you all so much for watching this presentation and listening to me talk, and I really hope you've learned something. If you have any questions, please feel free to reach out to me. I'd love to hear from you if you have anything you would like to say or any questions you may have. And here is my reference page. I hope you all had a wonderful Thanksgiving weekend, or if you're watching this before Thanksgiving, I hope you have a wonderful Thanksgiving weekend. And be safe, and we'll see you later. Bye!